out. If there is a sense of this was so senseless, this was so needless, it is so difficult for medics to come to get some sort of closure in those cases. And although we may have done the best job as team members of that cardiac arrest team, as team members of the trauma team, we never ever make peace. And the inside, the human being inside all of us, the mother in me, the sister in me, all of those emotions come to the front, and we really cope. We've seen staff in A&E as I said, I've been working in A&E, and I'm one of the hard persons who's hardened. However, when we have any kind of death due to which we deem as senseless, needless, it could have been avoided, it should have not happened. Even none of us will accept that people younger than us, children are not meant to be dying before us. We are not meant to be outliving. That's just wrong. Just wanted to, I don't know whether the pathophysiology or what happens. So if you get stabbed in the main organs, that is your chest and your abdomen, you have the main blood vessels there, and if somebody is stabbing you in there, it's just impossible. So the trauma services, the pre-hospital ambulance services, which have got a medic in there, and they've got loads of avenues of treatment. They've got loads of treatment avenues that can prevent the shock, that can make sure that blood supply is maintained to the heart, blood supply is maintained to the brain. But when you're hosing out, when you're losing out liters and liters in a minute, if the heart beats 72 times in a minute, and when you have any kind of trauma, it tries and compensates. It starts beating at 80, 90, 100. However, if there is a big hole in the heart, there is nothing that the heart can do. The brain cannot survive if it goes through 3 to 5 minutes of lack of blood supply, and nobody understands that. The body is meant to be strong, but equally the body can be very fragile. We are seeing an increase in the numbers of wounds so it's not just about a single stab wound. If you've got multiple stab wounds, be it in your limbs, be it in your peripheries, that can cause a significant amount of blood loss. And it's the speed at which the blood loss has happened, and all the the body is a beautiful piece of work. They've got so many, our human body has got a lot of compensatory mechanism. It quickly picks up that something is not right, and it starts all the compensatory mechanism, but then eventually, if the trauma is way too high and the intervention doesn't meet and there is a gap, the body has got no option but to give up. And I think in James' case, that's what happened. He tried. He was a young person, and the paramedics worked on him with the hope that they could try and stop the blood loss and make sure that there is enough blood in the system to send him to one of the trauma centers, and that would have been Queen Elizabeth Hospital. So we've got a good trauma service available, but the injuries were devastating. I'd like you to watch this clip. It's just for 2 minutes, but it's beautiful, and it talks about how medics deal with the emotional build-up.
I rarely remember a face or a name, but for some reason I never forget a tattoo. And that's when it dawns on me, I've seen that kid before. What are we doing here? You patch them up and you send them back out because that's the job. But you do start to think, what's the point? What is the point when they're just going to end up back here in 6 months' time? Or they're going to go out and stab somebody else? That's the thing. These kids, and they really are kids, they're just pushed back out there. And you wouldn't send a drug addict out there without some kind of support system, would you? You wouldn't, and these kids, they get nothing. They get absolutely nothing at all. And I hate to say this, but it seems to be getting worse. The kids seem to be getting younger. Or, by the time they get here, it's already too late for some of them. And you can't save them all. No matter how hard you try. They bleed out. Or the knife's gone in too hard, or they're just unlucky. And I think that's what some of them don't understand. This is real, and you might think you're invincible, but you're not. You get to come in here, but that doesn't necessarily mean you get to walk back out again.
And I think that the message is, we as communities, we as human beings, part of a community, we need to take it on ourselves. I think we will get the support from the police, from the law, but I think each and every individual, each and every family needs to understand what their kids are going through, need to try and be part of their lives and support them and give them an understanding of how valued they are and how fragile life is. Thank you so much, and I as a mother and as a doctor, if I can help your cause in any way, please let me know. But I think from ED point of view, from my department,